What's up, everybody? Hope you all having a great day. Today, I'm jumping on just to talk to you guys about longevity and the optimal framework that you want to adopt to ensure that you can maintain your muscular integrity and health and maintain your joint health so that you can keep moving pain free as you grow older. And I'm going to discuss a little bit about my experience and what I've seen working with people and the typical frameworks that people adopt. And from my experience, what I've noticed is that there's three main frameworks people have when it comes to managing or not managing their movement system, their muscular joint system. So the first framework that I see people have is essentially not having any decision making process. They essentially, maybe you're in your 40s, you're starting to notice some discomfort in your joints and your muscles. And this type of person just thinks that's normal. It's part of the natural part of aging. I'm supposed to feel this way, and they don't do anything about it. And it might continue to get worse, but they just leave it be. They don't do anything to improve those sensations or manage their system. And maybe they go their whole lives that way. And the time they're in their 70s, they're very weak and they're unable to walk or be self-sufficient. So they start using a wheelchair. They start getting in-home help, and they become reliant on other people in a very early age, in my opinion, in their 60s or 70s. And they never do anything to manage their health from a physical standpoint. This is probably the least successful way, obviously, to keep your system in an operating, functioning way as you get older. None of us want in-home help in our 60s. None of us want to be incapable of going to the grocery store, driving us around, picking up our grandkids. That is a very low quality of life, and I do not suggest this approach. The other framework that most people would take, this is probably the most common one, is that you start to have some issues arise, maybe in your 30s or 40s. You kind of feel a little knee discomfort. My back gets tight. Maybe I throw it out a couple times a year, and I don't really do much about it. I don't do anything until there's a big enough problem. So, like, I'm really in pain. This person's just having a big problem that is affecting their life. They can't walk now, or they can't do some activity that they really love. And it's gotten so bad that now they seek help. The problem with this framework, waiting till things are really, really bad before you seek help, is that it's very challenging to restore function from a place where you're broken. It's much harder to fix something than it is to sustain or maintain your current function. So the optimal framework I want to position for you guys, which is very uncommon in the Western society, especially in the healthcare industry, is preventative, proactive mindset. So instead of waiting until there's a big problem, start taking action now to maintain your current status at the very least. And you can also improve. There's always the potential opportunity to get better, even if you haven't trained up until your 40s or 50s, exercise is new to you. You start training, you're going to see changes. You're going to get stronger. But at the very least, you can keep where your body is at right now. It would be easier, for example, if you're in your mid-20s or 30s and you're not really having any physical problems yet, to start to introduce exercise so that you can sustain where your current status is, so that you don't end up having a big episode or a big injury that sets you back that you might not be able to recover from. My personal experience with my laundry list of injuries from sports, I have a ton of things that I have to do to maintain my ability to function around some of these injuries. If I don't manage them, they start to creep up and they start to impact me in negative ways. So I have to, on a week-to-week basis, care to some of these places that I've hurt so that I can continue to function, so that I'm not having big problems, maybe surgeries when I'm in my 40s or 50s. I want to prevent any of that stuff so that I can keep my quality of life where it is now as I get older. So if you are new to exercise, it's never too late to start. If you haven't trained in your 50s, it's okay. You can start now. You can you can maintain your current status pretty much at any point in your life. But if you wait till something breaks and then you try to fix it, it is much more challenging. And you might never get back to where you'd like to be. So the whole point of this for you guys is to understand that you have power by making choices right now. You can decide that, hey, look, I'm starting to notice a little pain in my kneecap. It's not, I don't like this pain. And sometimes it makes me limp. But most of the time it's okay. Or my shoulder, there's a little pinch. Sometimes I'm doing certain movements, but it's not so bad yet. Instead of waiting till it gets really bad and doing something about it then, start to take action now. Find out strategies and nuanced ways to improve your strength, manage your joint health, so that you can restore that function, get rid of those discomforts, because that is very possible. I do it on a daily basis. You start doing this now, you can start to restore function and strength around the joints that are bothering you. You can prevent big episodes. You can prevent surgical procedures that you might end up having if you didn't do anything. So ultimately, don't be someone who just accepts these discomforts and does nothing. Don't be someone that waits till these problems get so severe that you have major arthritic changes, torn ligaments, torn tissues, really dysfunctional, weak tissues. Don't wait to that point to do something, because it will be an uphill battle to make changes. Instead, be a proactive, preventative person who understands that, hey, look, I'm 30, I'm not getting younger. I need to start to apply exercise on some regular basis to maintain my strength, maintain my muscle health, maintain my joint health, so that I can continue to live a high quality of life and do all the things I want to do, so that you can have joy in your life, so you can experience all the wonderful things that life has to offer and not be limited by your movement system that is breaking down because you're not doing anything for it. And the cool thing about all this is it doesn't need to be 5 days a week, a 90-minute session in the gym. You don't have to crush it every time to achieve this. You can literally train twice a week for 30 minutes and you can see some positive benefits and maintain your function with that little amount of dosage. But if you do nothing, chances are things will start to break down, your health will decline, and when you get into your 60s or 70s, things are not going to feel the way that you want them to feel. So I hope you guys hear what I'm saying, and I hope this message hits home with some of you, because it will be a very, very powerful thing long term. But that's it for today, guys. I hope you all have a great one. I'll talk to you soon.